So in our body, we have actually two key areas. One is the pelvis and another one is this thoracic spine. So usually when the change I'm talking about, especially in women, the change happened right here because they load a lot to the front because of the breast and the body structure and all these things. They get loaded like that. So basically change do happen right here. And this change can happen because something may be going on in the pelvis, because that is a big connection, huge muscles, they go like that. Those are called the rowing muscle, right here. So even if you have a shoulder pain or back pain or anything like that, sometimes you find spasm right there. Feel like somebody's grabbing onto it. So right there. So that is the connection. So you might not have any problem in the shoulder, but if you have a lot of tightness around here, it is slowly is going to change. It is going to change the upper quadrant. So a problem may happen on the lower quadrant, which can lead to a problem in the upper quadrant, or you can have upper quadrant problem and lower quadrant. So sometimes to treat a shoulder, you have to treat the back. Without treating the back, nothing is going to change in the shoulder, because all these things are kind of connected. Or sometimes you have like a pelvic rotation. It happen in male, all those things kind of does not happen that much. Usually the male problem is they become tight. That is the main problem, is tight. In the female, the problem happens because the pelvis, it moves a lot. It is wide and it moves. So any pelvis that move, it became like unstable. Or we are going to do one test, if it is okay with you. That is the biomechanical change that happens. So if you can stand up, go ahead and stand up. If you cannot stand up, that's okay. Don't try. Okay, we try to stand up as tall as we can. We want to be straight here. Okay, very straight. Okay, now we are trying to lift the shoulder up, straight up like that, as much as you can. Don't force yourself. As much as you can. Okay. Now drop your arm. Now what I want you to do is slouch. Now try to lift your shoulder up. You're going to feel stuck. Do you see how it changes? Okay, have a seat. I just wanted to show you something. So see, your shoulder is, you did not change a thing. You only change from here. How you biomechanically completely get changed. And that is what is the problem. So in your body, biomechanic means if one area changes, so it can change everything else. So we can treat the shoulder, people say, oh yeah, I probably pull my muscle, this, that, We're going to get to the diagnosis in a minute. So if that we understand, like we understand the basic principle, we understand kind of the biomechanics of our body, then we can go forward to the diagnosis. So the diagnosis, what we usually call it, it started almost like when we discovered the antibiotics. Okay? Before that, church used to treat people. You go there, they're going to, or maybe depending on religion, they will take the evil spirit out of you, or they'll give you something to, have, and you are cured. And that worked. And it is going to work because you believe so strongly. But people used to die because of infection. A lot of people died because of infection, all kind of infection. Sometimes the whole town, whole village people died in the past. because of many infection. It could be tuberculosis, it could be cholera, likewise. But when the event of antibiotic, it was wow. I was about to die. I know many people are dying now. I took a pill and I felt better. I'm cured. So that is the basis of treatment continue to have even if today. But that time they did not have many things which we now having more. So that is what is the problem is. So we always think we need to have a diagnosis, so we'll match up with the medicine and it is somehow miraculously work. And it works in case of infection. But unfortunately, musculoskeletal condition, which is related to your muscles and your skeletal system, diagnosis does not work 98% of the time. Well, 1% is going to work because I can say fracture of left upper extremity of the humeral head. That is a great diagnosis. So I know exactly what to do. If the fracture is that area, then you can say, well, I'm going to plaster it, or I'm going to pin it, or do surgery, or put a plate. It is going to heal. That is great diagnosis. Everything else, when it is a process, diagnosis only gives you wrong information. Number one diagnosis. There is no reasoning behind it, which many people will say or do, pulled muscle. I pulled a muscle. You heard of that? Pulled muscle? Mm. You'll be shocked to know you cannot really pull a muscle. You cannot pull a muscle. Are you surprised with that?
Well, I always thought it was kind of a layman's term, you know.
Yeah, no, actually physicians they use it. They call it muscle strain. Like if you kind of medically transfer, they call muscle strain or sprain, something like that. Actually, you cannot do that. And why you cannot do that, I'm going to show you a video. That's going to make a little bit more sense. You cannot pull a muscle. Because, yes, can you pull a muscle? Yes, you can pull a muscle. But that time you don't pull the muscle. Like for example, you probably have seen people or have heard people, this muscle is contracting violently, right? So it is going to take a chunk out of here, bone chunk, and it's going to bunch up over here. So it pulls and takes the bone out of it. And it can happen in bigger muscle like here, quadricep. I have seen people. It's going to take a bone out of here, piece of bone, when it is attached, it can pull it out and it can bunch over here. But that we do not call pulled muscle. A muscle cannot be pulled. But what happens when they pull muscle? A muscle can go into a spasm, sudden tightness, on a protection mode. And that is not a pull muscle, that is a muscle spasm. That can happen like temporarily or permanently or something like that. A muscle spasm can happen. That's what we call pulled muscle. So as it is not a diagnosis, it's kind of used catch-all. And depending on your age, if you are going to a physician, and if you are a young or young-looking guy, and they say, oh, yeah, you are okay, you are fine, or then they are going to say, well, you have a pull muscle, don't worry too much about it. You're going to get better, like put some hot pack, cold pack, or do some heat rub. What do you call that? You get tubes of heat rub.
Icy hot.
Icy hot. You have to be careful about that. My mother-in-law, she had a spasm in her back, and she knows it well, and I don't know why she did that. She put the icy hot. This is what sometimes I warn people. I say don't use it, they're useless, because they cannot change anything. You can use pepper spray, that is more useful than that. She put the something, icy hot or some kind of brand name, and then she put hot pack on top of that. And she has a huge blister. Not one, 2 or 3, I guess. She had 2 or 3 blisters. In December when I went there, and I think she did that in November sometime. Of course, like after a month, any kind of thing, burn happen, like that kind of burn, it takes a long time to heal. So that is the most dangerous thing you can do. And that actually does not change the problem or the reason why you are hurting. So that is kind of a deadly thing, a dangerous thing to use. So yes, it can go to a spasm as a protection. So that is out of the question. So we are not going to worry about that. Number 2. Think of a bigger diagnosis. I can give billions, but I'm going to go with the bigger one. What people get very concerned. Rotator cuff tear. You heard of that?
Sure.
Yeah. I have a torn rotator cuff. That's the first thing people will come to their mind. They'll ask you, hope I did not tear my rotator cuff. So have any idea what is rotator cuff, what it does, what it does not do, what is the big deal about it, why people get so scared? Any idea? Well, if you have no idea, I'll tell you. Well, we have different kind of muscles here, okay? So they go there and they kind of give some stability to your shoulder joint, okay? But, you know, a plane, you guys ever flown?
Sure.
Okay. So a plane, in order to fly, you need to have minimum 4 fail-safe mechanism. Without that, plane cannot fly. Like a plane is flying, it has 2 engines, right? If a 1 engine fails, they can still operate. And they can land almost like 200-300 miles away. They can fly 200-300 miles and they'll land safely. So if both the engine fails, what they're going to do?
Land.
No.
Correct.
Actually, well, in order to land, they need some kind of power and they need some kind of steering. They actually have a third little engine underneath the tail end, and which gave them enough power to steer the plane and they can land. Okay? So they have all safe, false mechanism. If this does not work, that is going to work. So you have to fail like 3 to 4 times for a plane to crash. So as a human being, we are the ultimate. I don't call that we are machine. We are like a garden. But if we imagine ourselves as a machine, we have billions of fail-safe mechanisms. So nothing, we depend only one thing. So the rotator cuff, usually they are blended in, 4 muscles or whatever, and they kind of give some support here. Okay? So when a rotator cuff tears, it causes pain only again 1% of the time. And who you are going to worry and whose rotator cuff tear? Usually this is a young guy, maybe plays football, some kind of huge contact sports, soccer, baseball. They are generating, I'm talking about 50, 60, 70, 100 mile per hour force, right? They are using a lot of force. So these are the people get directly hit. I saw one kid from SIU have that kind of injury. So when they turn, yes, they have pain, and you can see they're snapping. Then you do X-ray, MRI, and yes, that is a torn rotator cuff. But again, 98% of the time, when people they tear rotator cuff, they don't even realize it, because it is torn not because of a trauma. Your tissue quality is getting bad, and your body is changing. The tissue is not good, your body is changing, it is rubbing, so it slowly but surely started kind of deteriorating. And you can easily see that in MRI, like kind of an old tear or a fresh tear, it can be easily identified. So some people will have a tear for maybe for 5-6 years, they didn't know, and suddenly they started to pick up a bunch of wood or something like that, and they started complaining of pain, and the doctor say, oh, maybe you have a rotator cuff tear. We use everything very casually, And the human body is not supposed to take casually because it is serious stuff. Now they'll say, oh, you go do an MRI, they do the MRI, they'll say, oh, you have a rotator cuff tear, I need to fix it. Well, what is torn for 6 years back, why you want to fix it now? And the second thing, is it needed to be fixed every time? The answer is no. What is our goal? Most of the people we see here, well, if you have $1 million contract or $10 million contract with a football, NFL, or I don't know how much they contract, 100 million, 200 million, I have no idea. Or you are a champion kind of sports guy, young guy, and you tore your rotator cuff, you need some surgery because you hope to recover and come back to play because that is your livelihood, right? But most of the people, they're retired. They just want to have a pain-free range. They don't care. They don't have $1 million contract. They just want to do the yard work, cooking. For that, you don't need the surgery to get it better, to have a painful range. In fact, the tissue quality is so bad, once you do surgery, they're going to immobilize you for 8 weeks or 10 weeks or whatever. Then you have to do some kind of therapy to gain range. It'll never be the same. Once you are operated, you can never be the same. Because these are called all virgin joints. This as well as knee. Once you have a knee surgery or a shoulder surgery, you will never going to recover from it. You're going to recover somewhat, but not much. Because they have to shrink it the way this surgery is done. So that is the story. Well, few things you cannot do if you have a rotator cuff tear. Yes, you are going to have a full range. You can be pain-free. You can do pretty much what you want to do. One thing probably you cannot do, you cannot throw a ball like 30, 40, 50 mile per hour speed. So how many of you want to throw a ball like, professional level?
Well, disc golf, I'd like to get back into the disc golf, but...
Well, that does not need that much of force.
Depends on the hole, but okay.
Okay. So if that is the case, so that is always you see, what you are gaining and what you are losing. So you always have to calculate that. So that is one. And another thing happens, third, I talked to one lady, a couple of them, they're supposed to come for this workshop. They have something heard of called as a frozen shoulder. So a frozen shoulder is that, there is some fibrous tissue built up, so you cannot move your shoulder anymore. So why they build the fibrous tissue to begin with? You need to remember our body is very smart. Our body is not stupid at all. It's very smart. So every time it does anything, there is a reason, right? Do you know why we have fever? Fever is bad, right? No? Yes? Fever is bad? Why our body creates fever? Why we have fever?
Kill bacteria.
Yep. If whatever, bacteria or virus or anything like that, your body has to raise the temperature to kill it. So if you are taking any kind of medication to reduce your fever to 0, like any kind of Tylenol or ibuprofen or anything like that, it is going to come back with a vengeance. Because body cannot do whatever you're doing. And again, you will never win against your body. So if you eat bad food, what is the first thing going to happen? Either you're going to throw up or you're going to have diarrhea. Your body is trying to eliminate. So body is very, very intelligent. But we get so stuck on the symptom that we have to stop the symptom right away. And by that we are actually hurting it. So that is a problem. So it creates symptom for a reason, to get your attention. So you have to do the right thing. So if we don't know the right thing, or we try to do things which is counterintuitive, so you get hurt, you get injured, So what is the first thing we do? We take anti-inflammatory, right? Do you know what is the first stage of healing? First step of healing is inflammation. inflammation, the name, it comes like angry, right? So it actually produces few signs. Color, rubor, dolor, the names are there. So the color is going to change red. There's a reason. Bloods are flowing. So in fact, they're turning on the fire alarm. Like if your building is connected to the fire alarm with the fire center, is going off. So if it is fire protection, first thing is going to happen is going to sense some fire or smoke. If we have those sprinkler system, it will be activated, sprinkling water. Then it is going to activate and the fire station is going to notify. They'll rush in, so that they can save or they can see what's going on here. So that is the job of the inflammation. So it sends all kind of signals to do all kind of stuff to heal that place. Now we just turning off everything offline. We turn off. No, we don't need anything. Or now we could turn off. The sprinkler system is not going to work. That is the counterintuitive thing. So when you do counterintuitive thing, well, pain or any kind of symptom will happen. If we have a body, all these things are going to happen. That is how we create suffering. Because that's what I said. Pain is inevitable. But suffering is optional. So what we don't know actually going to hurt us. That's what we create our own suffering. And we do the same thing again and again and again and again. I have a gentleman, he's a very intelligent guy. He is 92 years old. He was a physics professor for 30 years. And I just started seeing him last week. And this guy had back pain for whatever reason 25 years back. And then he's keep on having back pain. He's taking shots off and on for 25 years. They put him on every medication on the earth. Any medication you can think of. Like, anti-epileptic, pain medication. He can take Vicodin every 6 hours. Okay? Now, toward the end, they put a spinal cord stimulator on him, which did not work. You can feel the spinal cord stimulator. So, but basically what is going on, he's doing the same thing. So, shots, medication, and spinal cord stimulator. Now he went for surgery. The surgeon, he found a surgeon who is agreed to do surgery, but the insurance said no. We cannot allow you to have surgery. Remember, insurance companies are bad, but not so bad. They have the data. Well, the reason is different to save their money, but they have pretty good data on this thing. They say, no, you cannot have surgery. We're not going to allow you. Unless you do get treated for a couple of, 8 weeks or something like that. So that's how I get to see him. So this is how, when we do the counterintuitive, I've seen enough of human suffering. So that is what we are talking about. So that is the frozen shoulder. So frozen shoulder, your body became unstable. Remember when you do that, it hangs out, it does not move much. So when anything becomes unstable, your body try to make it stable. So it can only make stable by building up the fibrous tissue. So in order to build fibrous tissue, he has to make inflammation. So at first it can hurt, then slowly the pain goes away within 6, 8, 9 months. Then this fibrous tissue is so much, you cannot lift your shoulder up. That is what the frozen shoulder is. So these are all names. But some of the names are good because to have surgery, if it is because of trauma. Otherwise, whatever it is, it does not mean much because it is not a problem, right? So how much pain you have?